Well, not that one.
Oh, it should only be one sheet.
It was two.
We just use the same, oh, that, I don't know what's going on. This is the main one right here.
Okay.
Keep them both together. They can both be kept up there. Okay, we set up, Yutha? And I need the agenda. Shucks.
Yeah, right.
Yeah. This thing working?
Okay, yes, being recorded. Okay, it is now 6:39, and the meeting will come to order. We don't quite have a quorum, almost, with Michael on Zoom. I'm not sure who else I see, but we do have quite a few people on Zoom. So thank you very, very much for joining us tonight at this meeting. I apologize for our late start, but we had some wonderful teenagers here who are part of an arts and culture presentation in the other room. So we were excited about that. They were here. And so I didn't have as much time to set up. So anyway, that's a good reason, but at the same time, I do apologize that we're a little bit later. I want to welcome all of you again and say Happy New Year. And I'm wishing all of us the best possible in terms of our commitments that we make to ourselves and to others this year. Is my volume? Can you hear me? Oh, I see. I think there's an echo, so hold on. I have to unmute. Can you hear me now? Okay, yeah, I muted both devices. Okay, so you have the agenda. There is an update to the agenda, which has Project 2025 with Padmore John. And Padmore let me know earlier today that there will be a Mr. It's either Jamie, Mr. Estrada's, and he will correct my pronunciation at the time, but he will be presenting perspectives on the Project 2025. That's the only addition that I have. Have we can I get a vote? It has been properly moved and seconded by Heather Jason, our member, to accept the agenda as corrected and approved. In terms of our minutes were actually approved in December. They were done in December. Both November and December minutes were presented, and they were approved by our committee and presented to the board at its general board meeting. So we're ahead of the game there. For those of you who are new and coming to our committee for the first time, in the initial packet, the November and December minutes, along with the agenda, were emailed out to everyone. One of the things that I wanted to just highlight today in my own announcements and introduction, I was talking to one of our members And I mentioned it would be great for us to take a look at the 10 top priorities in health for our district. And of course, we could name a whole lot that's hard to select, but a few of the things were, I'll just mention chronic disease management. That means obesity and diabetes. And so in terms of obesity, approximately 29% of adults in our district are obese, which is higher than the Manhattan average of 16%. Obesity increases the risk of heart disease, diabetes, and other health issues. In terms of diabetes, the rate in Morningside Heights and Hamilton Heights is 9% compared to 3% in Stuyvesant Town and Turtle Bay. So effective management is crucial to prevent complications. One of the others that we have focused on this for the last couple of years, and it remains very critical, and that's mental health. So with mental health services, the community has expressed a need for enhanced mental health services, particularly focusing on youth and adult mental stress concerns. And of course, addressing mental health is vital for overall well-being. We've had presenters almost every month on mental health. In December, we had Dr. Cynthia Grace, who is a licensed clinical psychologist, speak on the stresses, particularly after the election and with the oncoming of the holiday season, which can be especially stressful. We had Dr. Judalise Gomez. She's a new friend and community partner, and she also addressed the concerns of mental health and stress among people, particularly among peoples of color. She actually sent something that I emailed out to some, and I can extend that email list again this year. Today happens to, not just today, but this month is Mental Health Month. And so, the providers, organizations as they are, want us to focus on that as a health concern and see how we individually and collectively can ease the stress or bring more attention to it, so that takes away much of the burden of society, especially with incidents that just on spur of the moment unexpectedly may come to harm many of us and create stresses for everybody because of danger sometimes happens with those who are mentally distressed, and they're bringing it out for display to broader society. Environmental health concerns, air quality, and noise pollution. And just know that with all of these issues, we being health and environment, presented resolutions to our general board. We talked about the levels of fine particulate matter in the district, which is 9.8 micrograms per cubic meter. That's higher than the citywide average of 8.6 micrograms. So poor air quality can lead to respiratory issues. Thirdly, as well. Noise pollution and asthma. Thank you. Noise pollution. Noise complaints, particularly related to loud music and parties, are prevalent in Manhattan, affecting residents' quality of life and potentially leading to stress-related health problems. Some people may poo-poo this whole thing of loud music in the neighborhood, but if you ever have to live below or above that sound, it can create great stresses to the body. Whether it's the vibrations that people hear and can almost have precipitated heart attacks in some, particularly those who may have some illnesses or among elderly. who already have certain conditions in addition, as well as young babies. But we've had have some resolutions related to noise complaints, so it can be a vital concern. So that's a pressing issue still in our district. Access to healthy foods. Even on television this morning, they were talking about ultra processed foods, which are, represents at least 58% of the food, and it could be higher, but I heard 58% of the food that we eat. And it's hard to avoid it. So they're not saying not to eat it altogether, but to be more mindful and read your labels and just be far more mindful of what we're taking into our body, because it's increasingly, particularly as our environment is changing, a prevalent concern as it relates to a number of diseases. I did that one. Maternal and child health. The rate of preterm births in the district is 9.9% higher than the citywide rate of 8.7%. Preterm births can lead to long-term health challenges for children. And again, particularly at our March forum, we had a provider, a specialist in this area, speak on maternal mortality, which is something very much similar. It's important that we pay much more attention to maternal health, which also can bring about suicides related to stresses that may not be exhibited or known in prior to birth or after birth. And we had a speaker come to us, talk to us about that, and I was actually surprised that a large amount of that health problems is related to stresses. And oftentimes mothers don't talk about, or if they feel they're not listened to in the hospital with their doctor. Housing and sanitation. So there are three more. Housing and sanitation. Approximately 71% of renter-occupied homes in the district have maintenance defects, compared to 59% citywide. Poor housing conditions can lead to health issues such as asthma and injuries. And if there's mice infestation, there's a disease, the name of which I cannot recall right now, that can also create problems and disease as well. Substance use and smoking. The smoking rate in the district is 18% higher than the city average of 15%, increasing the risk of respiratory diseases and cancer. We had a presenter last year that spoke about the dangers of menthol cigarettes. And oftentimes these cigarettes, the menthol, are heavily pushed in areas of Black communities. And that's been an issue for a number of years. But in the last couple of years, there have been organizations that have, in one group, coming to speak to us and encourage awareness about that. So it's very important that we're not exposed to cigarette smoke, let alone cannabis, because of dangers that it just from secondhand smoke as well. And we've had presenters on cannabis, how the consistent and prevalence of smoking, not so much, well, the prevalence, yes, but if you are taking a lot of cannabis, there is the risk of brain injury. Did have a speaker at our March forum talk about that as well. And we had a presenter at one of our meetings here as well talk about dangers of cannabis. And yes, we support the it's not for it not being a criminal use, And we know that how, again, people of color have been singled out, for marijuana use and all. So we're against that, but at the same time, but we are for those who really are using it for medicinal purposes. But you really need to be very careful if it's of extended recreational use. And the last is healthcare access and utilization. Approximately 20% of adults in the district lack health insurance higher than the Manhattan average of 15%, potentially heading to unmet health care. So those are highlights. And they are matched against a district report that, let me see if I the name. I will get that 2025 health priorities for the Manhattan District 9. And I will email this out to all of you and to share. And we will again try to come back and tackle many of these issues. In addition, I'd like for any of you, particularly those on our committee, if you have some matters or health concerns and environment that you would like to present to us, please, we welcome your concerns, and we know that it's something our community needs to know. We're working on not only a podcast, the main thing we need to do is make sure that we reach out to the community and make sure that we have sites that we know they can go on, using link NYC, whatever access we can get to inform our community, as well as going out and speaking to various groups and organizations, which our committee will do more of, as well as have an additional forum. We haven't quite gotten our date yet. It will be April or May. So thank you for listening to that. Please keep those concerns in mind, and we really are trying to be very proactive with our community. Any highlights? And I need some help. So if anyone sees a hand up raised online, please let me know, because sometimes I just can't see everything. I appreciate our committee member who is a law student, Michael Iglesias, for the second time doing minutes for us. Thank you so much, Michael. Generally, Dr. Torres is doing meetings when he is off and not available to see. He has two great people working with us to make sure that we have proper information. And that's a very important volunteer activity for us as well. And my last thing is we have CB9 Connects. There's a lot of information that is on CB9 Connects about our district. I'd love for I sent the link in the email. I will send it out again. And we would appreciate having your feedback to some of the concerns that come up strictly related to the district. And I consider all of you our community partners. So please sign up and keep us informed as well. So those are my announcements. And let's move on to our presentations. Are there any questions so far? Everybody, just help me out. Heather, help me out. See your hand raised, okay? And we have a quorum here now for sure with our second vice chair, Monique Hardick-Padera, who is a member of our committee. She's walked in, and so if we have to vote on something, then we have it made.
Good evening, everyone. Happy New Year, and many apologies.
Okay. Is Pauline Ferrante here?
Hi, good evening, everyone. Yes, I'm here.
Hi, Pauline.
Hi.
You see where if there have been a couple of emails that I've gotten in reference to norovirus, specifically norovirus, yes. If there's anything in particular that you can say related to that, fine, but
Also, anything happening health-wise in the city and the districts that you can inform us of, we'd appreciate it.
Sure. So I apologize that I'm having some tech issues, which is why I signed in a little late. So yes, it's true that there is increased cases of neurovirus across the country. And in New York, it's not a particular spike or anything, but we just want people to be aware that it is extremely contagious. But to take sort of precautions like during COVID, which is to wash your hands very frequently.
Can you hold 1 second, please? Oh, we're trying to get the volume up in here.
It's on max.
Right, it's on max already.
It's already.
So,
What about the other one?
Hey, does it go through the owl usually?
Because
Let me
I
see
might
if
be able to, it echoes.
Let me see if I
That's
open
the problem.
That could give you a little more volume.
Okay, Pauline, go ahead.
Okay, so neurovirus is something that is very contagious, and so we are encouraging everyone to, take those COVID precautions, which is wash your hands frequently, to stay home if you're not feeling well. Particularly if you're elderly, you're more susceptible to, getting more severe results due to a viral infection, or if you're a school-age child in particular, because we do know that congregate settings do spread viruses very easily. And so if your child is sick or exhibiting any symptoms of the flu or norovirus or RSV, we really encourage parents to keep them home. I know it's very difficult with working parents, but school settings and other congregate settings really do spread disease faster, quicker, because there are kids or people in close proximity to one another. So we just want everyone to really take care of themselves, to be mindful of how you're feeling. And if you are actively ill, to please stay home until you are better, to get tested, to go seek medical care. But really washing your hands frequently is what really does keep, keep you safe from germs, because, we touch things, we put things in our mouths, and that's how disease is spread. When people open mouth cough or sneeze, all of those things spread illness. And so we really just want to make sure people who are actively unwell do stay home, so they are not spreading disease everywhere. We aren't seeing anything in particular in New York where we're very worried, but it is something that is rising nationwide. And so we just want people to be aware in terms of neurovirus. Flu is very prevalent in New York, so we want to make sure people go get their flu shot, and again, all those other precautions to keep in mind. So I wanted to also just touch base with what Dr. Torres had asked last month about information with regards to other respiratory illness. So I checked with our team, and I will send him an email as well, since I know he's not here this evening. But we don't keep track of any other respiratory concerns like COPD, as he mentioned. But our EpiCurie database on our website is very robust. And again, I apologize for my technical problems, because I am not using my laptop, and so I can't show you or run through our EpiCurie website this month. But next month, I'm very happy to give the community board sort of a quick rundown of how to utilize our EpiCurie. I'm sure most of you have used it before, but just as a refresher, I'm happy to do that next month if that's okay. So again, I apologize for my tech issues this evening. So those are all my updates, and I'm happy to take any questions.
Do you have, let me see, I have to get rid of the echo.
Do you have? Oh my. Do you have any press release, Pauline, that comes out on various viruses?
So we don't
Because
have,
we can put it on our website.
we don't have a press release unless it's something like majorly, like a huge concern that we are, experiencing. But if you go onto our website, we have a whole about section. And in that tab, there's a whole section on news, and that has all of our press releases. So for example, on December 27th, we issued the top baby names for New York City. That's not very important in terms of health, but it's something that we keep track because we do keep track of vital records. But, so for the day before that, we issued a press release saying that the health department finds most adult New Yorkers infected with COVID-19 experience symptoms lasting 1 month or longer. So we have lots of really good information on our website. We have information about 2023 STI infection surveillance data. So I would encourage everyone to go onto our website, to our news tab, to see sort of what we're issuing news about. But then we also have, data on our website, and we have a flu surveillance page where we issue weekly all of the new cases that are arising in the city and sort of the trends. It's laid out. Again, Laquita, I could send that to you in an email. And if you want to share that link with the membership, I think that would be very helpful.
That would be wonderful, because we have some, at least 70-something community partners and professionals who listen in, and they have their link to their constituents and organizations. So I would like that. And then right now, if there's anything you may have already done it, if you could drop it to the chat, that would be great.
Okay, sounds good. I
Hi,
will
Laquita.
try.
I'm joining.
Oh, hi,
but I'm
Dr.
proud.
Hi, Edward. Can you speak up? You're having a technical sound here. Okay.
Thank you so much for the report and following up. I just had a quick question in regards to the pending strike that will be taking place at some of the city hospitals. I know that is not, our local hospitals who are listed to be in the strike, but we would like to know if the health department knows of any contingency plans that the city will be taking place if such were to indeed take place, because that would affect patient care throughout the city.
I don't have any information on that, but I'm happy to look into it, and I can send the committee an email as soon as I find out.
Thank you so much. I think that the strike is scheduled for the 13th, if I'm not mistaken. Please don't quote me on that. And I believe it's over 1,000 doctors who are planning to go on strike.
Wow. Okay. I will definitely look into this and email you tomorrow as soon as I hear back from our team here.
Thank you so much.
Thanks, Edward, for bringing that up, because even though they are not in the district, some of the people who live in the district go outside of the district for their hospital care and doctors. So that's important information to have. And that would be.
And what that does, Laquita, is that it creates a diversion plan, right? For those hospitals that don't have the capacity to provide care, they will be diverted to our local hospital. Thus, the care for the entire city will be impacted. So there's a plan if such were to take place. Just for us to know, so we can educate the community about this potential situation.
Absolutely. We need to have that information to be on our website, and we can disseminate again to the organizations that are on the phone with us now. Right now, we have about 20, and then we have about 5 here in the office. So we have some outreach, and our clinics and all can be alerted as well. Thanks, Edwin. Let's see, did I miss another hand? And just speak up if I don't want to miss anyone, but if I'm not seeing a hand, just speak up. Okay, Pauline, was that it for you?
That is it for me, but I will send you an email with all the links and all the necessary information.
Thank you, Pauline, and Happy New Year's.
Thank you. Happy New Year, everyone.
Thank you. Now, thank you again, Pauline. Pauline is the Manhattan liaison at the Office of External Affairs at DOH-MH. And so she's the person we liaison with at meetings and in between for Manhattan 9 and the Department of Health. We have several organizations servicing our district in the area of health and human services that have been awarded, I guess they're awards, they're monetary awards to continue the services that they do provide. And West Harlem Development Corporation, which was founded through Community Board 9, has deemed these particular awardees interest in terms of the work that they're doing and having a viable service that we can utilize or that impact people in our district. Two of them we heard from last week. That was 3.5 Miles Yoga and City Harvest, and they gave excellent presentations to us. This month we have 4 actually, and one I failed to mention because it was kind of like on the spot, and they didn't say anything when I failed to mention. But that's Warm We All Really Matter Inc. So I don't know if Maggie indicated that she would be a teeny bit late, but is Maggie here now? Exhale to inhale. Yes, okay. So Maggie, let's hear from you. Congratulations to Exhale to Inhale. You okay? Let's see. You need to be made a co-host. And while we're doing that, I will make Isaac and Wendy co-hosts so that yeah, I should be able to do it here. Let's here's Maggie. Here's Maggie. Not popping up here. Maggie.
Oh, exhale to
Oh,
inhale.
wait a minute. What's her name?
Let me try again. Can you hear me okay?
No, it's up there. Is it up there? Oh, okay. Didn't say no.
Hi there.
I did, it said aloud.
Can I just get it?
Oh.
Are you all able to hear me?
Now.
We can hear you.
Oh, thanks, Rosalind. Okay, great. And how about everyone in the boardroom?
Yes, we can hear.
Okay, great. Great. Well, thank you, Lakita, and thank you, Community Board 9, for having Exhale to Inhale. We are so honored to serve the district. Tonight, we'll just be sharing a bit about our work and open it up to any questions, and hopefully this can be an ongoing discussion for collaboration. My name is Maggie Laraga, and I'm the Executive Director of Exhale to Inhale. We were founded in New York City by a student at Barnard 10 years ago to fill an unmet need around creating healing spaces for survivors of domestic and sexual violence. So our mission over the last 10 years has stayed the same. We use the healing practices of trauma-informed yoga to empower survivors while helping communities develop the skills and knowledge to support them. In the last 3 years, we set out a bold vision to create a world in which every survivor has access to the healing power of trauma-informed yoga. For me, my background is in clinical psychology, so I have really found yoga through Exhale to Inhale, the whole idea of feeling comfortable in one's body, and also the focus on accessible mental health. So that's going back to many of the priorities that you mentioned at the start of the call, Rakita, about accessibility and healthcare utilization. We know that in society, there's 1 in 3 women and 1 in 4 men that experience some type of physical violence from an intimate partner in their lifetime, and that's often underreported for marginalized groups. We also know that survivors of sexual and domestic violence can face long-term and physical health challenges, including PTSD, depression, and chronic pain. These symptoms are often untreated because they don't feel reflected in the services that are being provided. We know there's a lot of barriers to care, and we hope to create spaces where survivors can feel safe, they can feel empowered, and have choice restored and body-focused healing modalities. So it sounds like one of our peers in the space presented last week about yoga, but you may be wondering what makes yoga trauma informed. Is the sound okay still?
Yes.
Okay. So our classes focus on creating safety. So they emphasize physical and emotional safety. Our instructors are trained in our own 16-hour survivor-developed curriculum to ensure that we avoid triggering language and behaviors. We also have a big focus on choice. So a lot of times choice is something that's been taken away from survivors of sexual domestic violence. So something even as simple as you may want to put your hand there, or no hands-on physical adjustments, which you may see in a typical yoga class. So those are some things that we do within our class. And then the last piece is really focused on around accessibility. So for most of our class participants, it's their first time taking a yoga class. They may think that yoga is not for them. They may not see themselves reflected in the teachers. So our classes focus on being inclusive and respectful of diverse experiences. We also have adaptable practices. So a lot of our classes take place in the chair. There's always options. So there's never a wrong choice within our classes. So those are some things that you might see if you attend one of our classes. So some things that we can do, just hearing about what the priorities of this committee are, is beyond our West Harlem Development Corps grant. We also have a free weekly trauma-informed yoga class that anyone in your district can access on a weekly basis live on Zoom. So that's starting weekly on January 15th, 36 weeks of online classes. This is something that developed out of COVID, and it really has allowed us to reach many more survivors and others impacted by trauma than ever before. So I'm happy to share information about those classes as a follow-up to this meeting as well. The other thing is that we also provide scholarships and continuing education around trauma-informed practices. Those are free. The continuing education is free of charge, so I'm happy to share that with anyone in your district. We have everything from birth trauma to racial trauma to other principles of yoga. So there's a lot of different topics there that I think would resonate with various community members. And if anyone in your community is interested in taking our 16-hour trauma-informed yoga training, we do also offer scholarships on an annual basis. So I'm happy to share those as follow-ups to the committee. There's also a lot of opportunity for collaboration. This is a picture of Ellen, who's in an elder abuse street fair. And we're able to provide demo sessions at street or health fairs. We'd also welcome any introductions to other groups within your network that could benefit from our support, because again, our programming is free, and our work in District 9 is made possible by the West Harlem Development Corps. We were able to expand our program this year and serve district residents at Harlem Dream House, Homeward, Nimick, CUNY School of Medicine, and CCNY. This has really allowed us to have a deeper reach. We know that sexual and domestic violence cuts across every background, and we try to create our services and spaces for healing in places that might not otherwise exist. This is my contact information, so I'm happy to share that with any of you for follow-up. And I do see a hand as well, so I'm happy to pause for questions.
Hi, I have a quick question. Thank you for the service that you provided. Do you have the demographics of the folks who are receiving your services?
Yes, we do, and I'm happy to follow up with you after the call on that.
Yes.
Yes.
Yes, can you please, that will be helpful for us to understand the population that is receiving these services in our community. So then we can try to understand the gaps that perhaps might exist if they do. So it's always nice to see the demographics of who is receiving these services.
Yeah, that's a great point. And I think that also leads to, presentations like this, the opportunity to present to you all and your peers on the other committees. We really want to raise awareness as well about how yoga can be a tool for healing. So, we know that trauma can disrupt the nervous system. We know that many folks, whether it's from something like sexual or domestic violence or just environmental stress, like the election that you mentioned earlier, or other aspects of just life. We want to make sure that this healing tool is accessible to as many people as possible. And that does take folks like all of you spreading the word about it. So if there are other opportunities for us to come to street fairs, we want to break down some of the stigma around who can do it and what it looks like. So, a big focus has been reflecting the communities that we serve through our teaching community. And I think we're doing a pretty good job of that and would love to have, I know one of our teachers that is actually a District 9 resident, and others that live in the city in and around the Harlem area. So would love to have folks attend any street fairs as well if that's an opportunity.
And we will have an opportunity through our public health forum as well. So all of the health and human services awardees are invited to participate.
Great.
And we'd like for you all to continue coming to our meetings. You're on our mailing list now, and continue to come, to get information, meet people, even if it's online, to get their information, meet, see how you can work together and help each other. So we look forward to getting information also that Dr. Flores asked about the demographics. If you can send that to me as well, I'll make sure that everyone on our list will get that information.
And I would add, Maggie,
Great.
that in our community, people are facing different stressors, and there's different type of abuse. Many of our native tenants in the communities, they're facing abusive practices by their landlords, and some of these, therapeutics, through yoga, that can be helpful when folks are dealing with lack of heat. They're dealing, it's not going to get you warm, but there's so much stress that goes into that. Even just trying to get them to courts, even just trying to get them to give you the basic human rights of living. So I think that this is something that can help beyond the scope of what you're doing now, because our community is dealing with a lot of stressors.
Yes. Yeah, thank you, Dr. Torres, for highlighting that. And, we even find in our work, a lot of survivors can't leave the situation they're in. And so, going to seek out services from a major provider is not possible because it puts them at danger. So, while it's not something that can cure everything, just as you mentioned, feeling that safety in your body again, feeling connected to your breath, and that there's something that you can do in the moment, it can sometimes help when you're in an incredibly overwhelming situation. I also want to know, we do, in addition to the weekly public classes, we do have classes in both English and Spanish language that are available. So that's another thing, if you are a native speaker and you go into a yoga studio, you're not necessarily going to have, A, it's very difficult to do that. It's expensive. B, you may not even have the language access. So that's been another priority of ours as an organization. And we just are so grateful for this community-based partnership and the opportunity to present tonight.
It's a wonderful service. We should have a flyer so we can have it in our clinics, because I can see some of our patients that, if we have these flyers, in combination with everything else that we're providing them, this can be something that people can try and they can see accessible, because there's a barrier when there is a fee attached to, accessing yoga. And this is good. I think that more people should know about it.
Yes.
Thank you, Dr. Torres.
Any other
Great.
questions?
Well, great. Well, I will plan to follow up with the demographic information and then a flyer, as well as some of the additional resources that you all can share beyond our work with the West Harlem Development Floor Grant. Thank you all so much.
Thank you, Maggie. And again, I need your help if you see someone who has a hand up or something in the chat. And I noticed that some while back when we were talking about respiratory ills and I believe related to housing, Miriam, our former co-chair of this committee, and very invaluable to us, mentioned mold. And that's one important, significant danger that also creates a problem for our housing matters.
It's a big one in our district.
Yeah, I agree. And also, not only the mall, but also the abatement of the mall, that many times the landlords that I have seen in many buildings, they do the abatement without the proper protocol, putting at risk the entire family in those units. So I think that I know that HPD has a sheet that they give out to tenants. So I think that we should also have it in our committee so we can, distribute it and have it accessible to people. Because it's a big problem, with all the leaks that we have in the apartments.
That's a great suggestion. And Michael, can you make a special note of that for us in the minutes as a highlight in terms of that abatement sheet that Edwin just made reference to? Thank you both. Any other questions? Okay, we're moving right along. Isaac, you're getting a jump on you. We're not at the end of the evening this time. So my apologies.
Oh, I guess I was on mute. Thank you so much, Lakita.
Is Executive Director of Broadway Community and also a grantee. So please speak. And so far we're doing pretty good with timing, but we have two special presentations. So I want to make sure we have enough time for those. Isaac.
Thank you so much. Well, hi, everyone. Thank you so much for being here this evening. I'm very pleased to present on behalf of Broadway Community, where I serve as Executive Director. I just dropped a link in our chat with our agency video. It's about 5 minutes, describes everything that we do and the reason why we do it. But in short, we're a 43-year-old human service agency located on 114th and Broadway, and we provide a broad range of services for our neighbors experiencing homelessness, hunger, and social isolation. So we meet our neighbors' basic needs, including for food and shelter and medical care. We have a soup kitchen 4 days a week, a medical clinic twice a week, shelter 7 nights a week, 365 nights a year for 19 single adult men and women. And then we also help people break the cycle of poverty. We offer case management on site. We have a social worker as part of our staff. We have a workforce development program whereby we help our guests create resumes, cover letters, and apply for jobs and connect them with vocational training opportunities. There's a lot that we do. And whether we're attempting to meet the immediate or long-term needs of the folks that come through our doors, the one thing that all of our programs share in common is that they attempt to really restore dignity and hope to those that we serve. So that's what we're all about. Community is in our name, and it's really at the core of our identity. So we try to, bring everyone into an environment where they feel valued as an individual and where they know that they will be respected and, treated as whole. So that's what we do. We serve hundreds of people every week. Our soup kitchen is open on Mondays, Tuesdays, Wednesdays, and Fridays. Between 200 and 300 people come to us on those days. As I mentioned, our shelter operates 7 nights a week, 365 nights a year. We have 19 single adult men and women that stay with us as part of that program. And I think very fitting to an earlier conversation in this meeting is that we also have a medical clinic, as I mentioned. And that medical clinic is able to see folks regardless of immigration status, insurance status, or housing status. In 2023, about 250 people were seen by the medical clinic, and it remains open to anyone that needs it. So real practically, before I turn it over to questions, I'll just share something exciting that we're rolling out in the coming weeks. We've created these business cards that are really intended to give, anyone that is of good faith and wants to help, the opportunity to direct people to our resources. I personally have found and heard, of course, from friends and colleagues of mine that, when you pass someone on the street that is in need of serious help, oftentimes one is really puzzled at what to do. But this is a really concrete and powerful way for someone to make a difference. Just give someone this card and say, hey, on 114th and Broadway, there's a place where you could get free food. You could find a shower, access a bunch of social services, and you just have to be yourself. You don't have to pretend to be anyone. You don't have to bring any sort of documentation or pay anything. You can just come and be yourself, and you will be accepted as you are. So, Lakita, I would love to drop these off by the district office at the end of this month. I'm actually away until January 20th, but when I come back, I would love to do that.
Okay, or if you have it as an email or flyer.
Yes, absolutely. And I will also share our weekly calendar with the chat. I'll share this over email as well. But I would just refer to it as a cheat sheet. It lists all of the services that we have that are open to the public. Our shelter is by referral only, so that is excluded from this cheat sheet. But everything else is completely open to the public, no questions asked. And yeah, we're hoping to, continue to make a serious dent in the homelessness and mental health crisis that the city is experiencing, and of course our neighborhood has not been immune to.
I like the medical clinic.
Yeah, it's in partnership with the Institute for Family Health.
Laquita, there's a question in the chat. Is service available for youth?
So
the question is from BioBus, Christine, are your services available for youth?
They sure. So as long as youth are accompanied by a parent or guardian, they could absolutely access our services. The one exception being our shelter program, which is exclusively for single adult men and women. That said, even if someone does come to our site and requests help obtaining shelter, we won't turn them away empty-handed. We have shelter referral sheets, which I'll actually pull up on my computer and I'll send this along as well. Just broad overview of all the drop-in centers and all the intake centers that folks could go and access shelter. We will give individuals or entire households Metro cards to make it to those drop-in centers or to those intake centers. So I'll share that as well in the chat and over email.
Thank you. Any other questions for Isaac? And
I have a question. Isaac, who can make the referrals for the shelter?
So we work in partnership with the Manhattan Outreach Consortium, which is a collective effort between 3 major social service agencies: Breaking Ground, Goddard Riverside, and the Center for Urban Community Services.
Okay.
And they're contracted by the city to provide outreach across the borough of Manhattan. So all of our referrals come either directly through them or through kind of a retroactive referral through our soup kitchen. So someone could come to us and say that they need shelter. We'll fill out a referral form, send it over to the Manhattan Outreach Consortium, or MOC for short, get their approval. And once we have that approval, we'll be able to welcome the person to stay with us.
So is there a system where, you know, if a provider writes a prescription for them to follow up on a shelter, that they will have access? The patient comes to see me, they tell me they're homeless, and I'm like, look, here's a prescription. You can
Mhm.
go to this shelter and you'll be able to you know, to be taken care and follow up.
That's a very good question. To be quite honest, I'm not sure how other clinics handle it. I do know that the Institute for Family Health does offer, you know, through our medical clinic, free prescription management. So if someone has an inability to pay, you know, they could access
Yeah,
the.
so the prescription is something that we know, but this is tackling another issue, right? The social determinants of health,
Mhm.
which is that if a patient goes to see any provider in the community, well, they have the access to put in the prescription pad, a homeless person, go and seek, you know, help, they will get help here. Probably it doesn't exist, but I think it's something that if it's not implemented, that we should explore, because a lot of times patients, they will go to see their PCP and they're probably experiencing homelessness, and then you have a provider who doesn't know what to do after that,
Right.
because a lot of our clinics, they're small clinics, they're not like the big hospital that have the social, you know, the social workers and everything. So just to put it out there, because I think that, you know, homelessness is a big problem in our community.
Absolutely. You know, something I would love the community board's help with is just disseminating those business cards to those health clinics in the neighborhood, so that when someone that is experiencing homelessness comes through, you know, the providers could just refer them to us, and we'll, you know, do our very best to take care of the rest.
Yeah, because that will be very powerful, because a lot of times you see the providers that you know, you just don't know what to do when somebody tells you, look, I'm homeless, and you're like, okay, you know, what do we do next? But this will be very helpful for them.
Yeah.
Yeah, and I'm also happy, you know, if the community board would like to convene, you know, a meeting with all those providers, I would be happy to kind of give a breakdown of the homeless service system at large and what folks should do, you know, if they do encounter a patient that, you know, is in need of shelter or other emergency support.
That would be great.
I will also say one more thing, which is, you know, we're on the surface a pretty small organization. We're in the basement of Broadway Presbyterian Church, but so much happens out of that space. I mean, it's no larger than, you know, a medium-sized gymnasium, and I think part of what we hope to do, especially in 2025 and beyond, is just serve as a model for other programs in the city, model for holistic care, and just, you know, overall like dignity of service. Um, so, you know, if there are other houses of worship that anyone on this call is aware of that are interested in doing something to, you know, help ameliorate the homelessness and hunger crisis, I'd be eager to connect with them and, you know, see how we could potentially help.
Thank you.
Hi, Isaac.
Cindy,
This is,
Status, did you have a
can you hear me?
question also, or did you have your hand up? I'm sorry if I missed it.
I have a question.
Yes.
Can you hear me? Hi, Isaac. This is Darren Hope from the Department of Health.
Hi.
I have two questions. My first question is what is the start age that is one considered an adult? And also, what is the length of stay for an individual seeking shelter services?
So 18
And what is
years.
your bed count?
Yep. So 18 is what we consider to be an adult. Anyone else will refer to one of the youth drop-in centers. So with the Ali Forney Center,
Mm-hmm.
normally. Um, and the average length of stay could really vary. I mean, I would say on average about 4 or 5 months, but in truth, we have no time limit. And a big reason why is because we're working with folks that are coming directly off of the streets, and many of those folks have just been residing on the streets for years because they've had such terrible experiences in the shelter system before. So we try to make our shelter and our, you know, pace of case management, we try to make it as comfortable as possible. So, you know, we have a lady who, you know, she is experiencing serious mental illness at the moment, serious untreated mental illness, that is. And she's actually been with us for 4 years. And I will say it's no lack of effort on our own or on Mock. This lady has a voucher. She, has been given numerous opportunities to move into apartments, but after staying at a certain place for X amount of time, it becomes home and it becomes really familiar. So, we have some outliers like that who have been with us for longer than they perhaps could have been if they took other opportunities. But then for folks that are really driven and are willing to take whatever opportunities come their way, we could get them into permanent housing within a matter of a couple months. We have access to, I should share this, we have access to a system called CAPS, the Coordinated Assessment and Placement System. And it's administered by HRA. And through CAPS, we could complete and submit 2010E supportive housing packets for folks. So, the timeline, to answer your question, it varies how long people could stay with us. We won't pick anyone out.
Thank you so much, Isaac. You sound extraordinarily person-centered, which is sometimes very rare to find. So I look forward to continuing corresponding with you.
I would love that. Thank you.
And Miriam just stated that the food is really good and served and center services a lot of people.
Yes, Lakita, I don't want to eat up too much time, so definitely feel free to just shut
Yeah,
me down.
we do need to move on, but we have a couple of other questions. Monique, maybe your team is small and I probably know the answer, but I'll ask anyway. Do you do outreach, like going out and looking for people, or if somebody tells you I'm aware of somebody being at such and such a location? Do you have people go out to engage?
We do. We always recommend that if it's really beyond, I would say, like 10, 15 blocks of where our offices are located, that folks report to 311. But, if they're within our vicinity, we'll certainly go out there.
Okay.
I'd actually love to add one other thing, not to shut off any other questions. I'm happy to answer as many as there are. We recently enrolled in a program with United Way called Connect to Care. And Connect to Care is a really special program. I actually think it would be great to have the community board's partnership on it. Essentially, we have received funding to hire 2 part-time so-called health advocates. And those health advocates have 3 principal responsibilities. The first is to do health advocacy on behalf of our guests. So accompany our guests to appointments, make sure that they're getting the care that they are entitled to, and making sure that their concerns are not just swept under the rug. That's responsibility number 1. Responsibility number 2 is just community outreach and scheduling preventative health events. So vaccination drives, handing out contraceptives, educating folks on the dangers of hypertension, diabetes. And then the third is facilitating these so-called lunch and learns, whereby every 2 weeks we invite folks to come into our space and enjoy a really nice lunch on a day where the soup kitchen is closed, and learn about a health-related topic. So I'm happy to send more info on that, but I think it would be great to spread the word far and wide.
Thank you, Isaac. If you're interested in getting the word out, the only thing I always say is at every meeting, flyers help, to use the link kiosk so that people see that information, because it's a valuable resource. And, we have a lot of people who look at the kiosk. So
absolutely,
I offer that.
That's a great recommendation.
Yeah, it was mentioned as Link NYC at the outset. We were talking about wanting to get the information out that's shared here to the broader community. Thanks, Monique. But when we say the kiosk, it is the Link NYC. And as we understand it, there's no fee for not-for-profit organizations, put their information on it.
That's fantastic to learn. definitely gonna follow up on that.
Right along. Thank you so much. And let me say to Maggie, Isaac, Wendy, and well, we have Warm here. I already have theirs. If you can email now or tonight, before 9 o'clock, your attendance form, I can get them printed out, signed, and scanned back. Okay, more quick.
Fantastic.
All right.
Thank you.
Okay, so next we have Wendy Millette, who's been a wonderful friend and partner to CB9. And as it relates to young people, the Tall Omega Charitable Trust Fund. And they've been funded again with a grant. Wendy is the chair of the Tall Omega Charitable Trust Fund. And we'll need to speed it up because we do want to spend more time with Q&A with you. But, Wendy, do your presentation, then we'll have questions for you. Wendy?
Can you hear me? Can you hear me?
Yes.
Okay. So my presentation is on the screen. And good evening. Thank you for the introduction. The Tall Omega Charitable Trust Fund Incorporated is a nonprofit organization that was started by the Tall Omega chapter of Alpha Kappa Alpha Sorority Incorporated in 1968. Since June of 2022, we've been the recipient of grant funds from the West Harlem Development Corporation to implement our Making It Through program. The program is to provide young people ages 14 to 25 with relevant information regarding the signs, symptoms, and possible treatments for anxiety, depression, sleep deprivation, and stress. These are mental health disorders that they may experience in their daily lives. From the beginning of receiving the grant, we fostered a relationship with CB9's Health and Environment Committee initially, and expanded to the Youth, Libraries, and Education Committee. We've enjoyed working together on our mutually beneficial activities, and we thank you for the committee's support. And I'd like to acknowledge one of our board members, Rosalind Graves Wilson, who is also here with us tonight.
Welcome, Rosalind.
Yeah, thank you. So the Making It Through program is delivered to young people through varied communication channels that's curated by a team of mental health professionals and consultants. The messaging delivered is to help the young people and their parents learn and understand about mental health disorders in an effort to destigmatize talking about mental or behavioral health issues. Our program implementation is comprised of participating in community events to promote the program. At these events, we distribute printed materials about the program, mental health issues, and hand out giveaway. Usually, a mental health professional is available to handle any clinically related conversations. For 2025, we look forward to participating in your public health forum, as well as continued support of the Tau Omega chapter, Alpha Kappa Alpha Sorority Incorporated's annual college fair. It was held in October at Manhattanville Boys and Girls Club, and it's our hope to host this year's event at Columbia's Forum. We couldn't get the date together last year, but hopefully it'll work this year. So another delivery method is to conduct workshops, what we are now calling Let's Talk sessions with the young people. Parents and adults are always welcome to attend as well. We found that when we collaborate with programs that have established relationships with young people, such as schools or community centers, to be the most effective way for us to reach our target audience. Currently, we're conducting our workshop series at A. Philip Randolph High School for their after-school Gateway to Higher Learning Medical Academy program. We've created 4 videos that address the topics of anxiety, stress, depression, sleep deprivation, and what to expect when seeking treatment. Here's a snippet of the latest one, what to expect when seeking
through
therapy.
rocking the best you.
During the initial assessment, which I will refer to as the engagement process, a therapist uses active listening skills to learn about the client, to assess what their needs are.
I like to think that the therapist is there as a guide, someone who's guiding you through managing some of your feelings and some of the things, some of your thoughts and some of your feelings. I like to tell my clients that as a therapist, I'm in the passenger seat, you're in the driver's seat. So it's your responsibility to take control of your life. I'm kind of just guiding you to help you cope and figure out some strategies to help you feel better and to help you narrate or navigate rather those cognitive distortions, those negative thoughts.
You got this. Therapy is all about making it through the hurts, pains, disappointments, and traumas to unlock the best you.
The videos have been shared in workshops on social media and will be available to view on our website soon. Tapping into young people's attraction to social media, we maintain accounts on Facebook, Instagram, Twitter, and TikTok, where we post relevant information at least twice a month. Engagement is highest on our Instagram account. A mental health professional serves as the editor for a monthly newsletter that we distribute to our program subscribers. The newsletter content is an article addressing that month's mental health topic, a game or a puzzle, and resource information corresponding to that month's topic. Many Health and Environment Committee members are on our distribution list. So in October, we were invited to the committee meeting to discuss depression. That month's mental health topic. Tricia Filbert, licensed clinical social worker, and Sharon Cook, licensed clinical social worker were the presenters. Our website was recently updated to be a repository for our newsletters. Excuse me. And we will soon add links to the videos as well as create a space for individuals to pose non-crisis questions that will be answered by our team of mental health professionals. By the way, we are seeking to enlarge our team of mental health professionals. So if you are aware of any, please, I can share the task description with you. So I thank you for your time and attention, and we look forward to continuing our relationship with Community Board 9 for the benefit of the community we both serve. I'll put both the program and the charitable trust email addresses in the chat. Please feel free to reach out. And if there are any questions, I'm ready to take those.
Thank you so much, Wendy. And programs are really exciting that you have beneficial, and you guys have participated with the community board in several of our key projects, and really appreciated. Projects have been very successful. Any questions? Just speak out, because I'm not seeing hands, but right now, but just speak up if you have questions.
Yes, hi, Wendy.
I wanted to bring attention to is that in the chat, there were some comments that I missed, and I'll just, as people are thinking of anything they want to ask of Wendy and the Tall Mega chapter. Let's see, Dr. Yana Ronstrom said, can you, she was referring to Isaac. Can you send that card in digital form so we can print them up ourselves? Isaac, you can answer digitally on the chat.
Absolutely.
And Dr. Maritzi mentioned something very key. She's founded BioBus and is with Columbia University Irving Medical Center. It would be great to have the info. More than 146,000 New York City students, about 1 in every 8 children enrolled in the public schools, experienced homelessness during the 23-24 school year. Big number. The 9th consecutive year in which more than 100,000 students were identified as homeless. So it looks like that number is growing. We can spread this information for guardians through the youth. And then Miriam, West Harlem CSA, I'm not sure what CSA is right now, Miriam, has been operating out of
Community supported agriculture.
Okay, and they have been operating out of where? Broadway Community?
So it's a seasonal co-op made up of residents, and you basically buy shares from a farm, and it's delivered to the church weekly. It's been operating out of the church at least 17 years.
Okay, then as the food kitchen feeds many seed, oh, okay, we already cited that one. So it's important information that was in the chat. So Wendy, I'm coming back to you and the work that you do with young people. All of the presentations seem to really come together very well, and it seems like there may be opportunities for you to work on each other, as well as reach out to some of the others that are on this in this chat. Any other? Am I missing any hands up? Question.
Wendy, I have a question. Actually, 2 questions. So, you know, part of the problem as far as why young people don't reach out to get mental health, there's 2 parts. One is, you know, fear of retribution. So my first question is, when young people do go out and you know, talk to your organization, do you disclose this information to their school counselors or to their parents? And okay, so it's completely anonymous?
Yes.
Okay.
And it's usually in a workshop setting. We don't have one-on-one sessions with them. So sometimes during the conversation, they may ask a question that will lead to follow-up conversation. And one of our social workers will just take them to the side to have discussion with them. But that's it. There's no follow-up with anyone else.
Right. And then the second question is, you know, as you point them toward services that they can use, are these paid services or are these free services that they can use? Because that's another barrier why people don't go to therapy.
We try and give them free services. Like one of the places that we've been promoting is Teen Space, which is a New York City program that they've put together for young people. So in our newsletter and on our website, that's one of the places that we refer them to. We also refer them to NAMI. But the other thing is this, we are aware that there seems to be a shortage of mental health providers, whether it's free or paid. So it's a difficult, I guess, a difficult situation for us to manage, to provide the individuals with the kinds of services that they need.
Right.
And I would like to acknowledge Ibrera, because Sharon Cook did meet with her, I guess last year or this year, last year, to talk about collaborating. Yes, it was after the forum, yes.
Thank you for being here, Andrea. Thank you, Michael, for those questions. Any other concerns? I don't know if there is a list of psychologists. It's always, even with hospitals, there have been instances that we've learned of parents with their teens or adults going to the emergency room because of some mental health crisis and having to wait weeks, months before there's an appointment. So you're absolutely right, there's a shortage. I don't know what we can do about that. If there's any suggestions, I'm not sure how many people are entering the field, number one. So if I remember correctly, not this last session, but Dr. Grace at another time speaking to us talked about how few people are entering the profession because of the difficulties. So if there are any suggestions, maybe that's a project we can help with by coming up with a list and getting it out to organizations, to clinics, who are working with young people and even to schools. So if there's any idea, any suggestions you have, please let us know.
That would be very well received if we worked on putting it together.
Yes.
Thank you.
Next is we all really matter. And if I need both of you to say your names, even though I heard them earlier. But I'm happy they're able to give us a few minutes and then we'll go into our two special presentations. So if you spend time giving, and I know Warm has received in its second year, maybe third, a grant. Congratulations on that from West Harlem Development Corporation. And tell us about the organization. First, state your names and your relationship to the program. And then tell us something about it, and then there'll be Q&A.
Good evening, everyone. My name is Louis Carter. I'm the outreach coordinator at We All Really Matter Warm.
And I'm Christina Perry, I'm Director of Operations at Warm. And yes, so Warm has been a grantee with WHDC since 2022. And we're very excited about continuing the work that we do in the community, West Harlem community.
And I guess I'm not, as being an outreach coordinator, my job is to be in the community, spread the word about, the services we provide. First, I'd like to thank MCB9 for allowing us and assisting us to continue to do our work in West Harlem. And it's TV, and it's a serious subject. It's a serious subject. And I want to commend all the other organizations that came before us to speak. You're doing amazing work, and I would love to collaborate with y'all later in the future. But the domestic violence in our community, ladies and gentlemen, is running rampant. And the number one obstacle is working, on the ground that I see that the number one obstacle is the lack of knowledge and resources that people tend to have available to them. How's this working? Hold on, sorry guys, technical difficulty. Okay. A lot of people don't come forward, yes, out of fear, but they don't know that the resources that are available to them. I grew up in New York all my life, and I grew up in a time where it was, boy, mind your business. I don't have nothing to do with you. But it does, because we are a community. And as a community, we have to fight for those who can't fight for themselves. Not because they're cowards, because they can't. And a lot of times people don't tend to take into the fact of the children. The trauma that these children are witnessing and harboring throughout their lives is what we see now, the effects. Kids running around in the streets shooting without a care. That's not normal behavior. That's issues that they haven't dealt with. There's issues that they're harboring. It's anger. And we as a community, we have to come together. And I stress this all the time in going up there. It really is up to us because we know what's going on next door. We know what's going on down about just how we know that the noise pollution. We know who's playing their music loud. We know who's illegally parking and all this stuff. We also know what's going on next door with the abuse. And I know a lot of times we don't want to get directly involved because of fear about physical, and I get that. But here at Warm, that's where we coming at. This is our organization. I don't want to say this because I work for them. We are amazing. We come and get them. That's our thing. Get them out of these situations that are life threatening, literally life threatening. You know, and I have I'll share in a chat this resources that we provide free of charge, classes, services. We help with housing, we help with HRA, we help with childcare, we help with order protection, we help with getting them out of these situations that are so hard. And we understand that, we can't do it by ourselves. We get that. And it takes the community. And I want to thank CB9 and all you guys who's tuning in for spreading the word, not just about this organization, but all organizations that came before it, because we come together at parties, we come together at dark parties and all that stuff, but we need to come together where it really, really, really counts, not to save a life, but that's what we're trying to do. Save a life, make life better. Not only for us, but for the children, the elderly, regardless of your gender or whatever that case may be. Everybody wants a better life. And I think as a community, we can achieve that because I've seen a change. I see it, but I do feel that it's a lot more that we have to go. Like I said, I'll put in the chat. I don't know how to do it. I'm not a tech person, but I'll put in the chat our resources, classes that we provide free of charge, and we here, wow, we already met up. Like I said, we do outreach. You guys can see us purple tent. Purple tent, we out here, rain, sleet, snow, we like to post people. It's because we care what we do. We care about what we do. And when you do that, there's nothing that's gonna stop you. So any questions? Anyone?
Thank you, Louis and Christina.
Yeah,
I know we have a question from Monique.
Yes, Monique.
So you said you set up a purple tent.
Yes.
Where are you physically housed? And it's the assumption that you're incognito in case people want to come in and need to speak to you, or like how do y'all?
Yes, can I go to my address? Yes, we're located at 126th Street, 8 West 126th Street at the WeWork building. We don't usually do walk-ins, but you can call ahead and we can make an appointment and get you in. And as far as outreach, we're all up and down. You're seeing us all up and down West Harlem. We do Love on a Block, Manhattanville, St. Nick Projects, Broadway. And I don't know if people are aware, but I think Maggie, she hit the numbers. 1 in 3 women, 1 in 4 men. That's a lot. That's a lot. That's the adults. We didn't get to the children aspect of it. And people don't realize DV is not just physical, it's psychological, it's emotional, it's financially. So if you have clients where, they checks are being held against them. There's a whole gambit of this DV stuff. And I think, educating the people, because a lot of times people are in situations, they don't realize they're in that situation. They just think, oh, he's this or she's that and this and that. But they're in these DV situations. It doesn't get better. It does not get better. It escalates and escalates. So, yes, to your questions, we're on 8 West 126th Street, the WeWork building. You can call for an appointment, or you can refer people, and we doing what we can do to get these people out of these situations. That's our goal, and then what's so unique is we come get you as you are. We bring the cats, the dogs, the cat litter, the babies. We want you out of that situation, and we work out everything else. So that's what we do. We call it the CRT. We come to get you, because we know the most dangerous part of those getting out of situation is leaving. And a lot of times people trick themselves, oh, let me grab this. You don't need none of that. I'll get you your paperwork, I get your social, I get your cat, his catnip, whatever. We need you out of that situation so we could get you on the right road to happiness. Because that's ultimately that's what it's about.
Sorry.
Oh, and the CRT means critical response team. Yes, ma'am.
Sorry, because I'm thinking about it, I promise. I mean, Wendy just talked about the services they're offering to youth. And I don't know how, like, if there's an age limit, you're probably focusing on adults, but I always think about young people being in
Me too. That's my
where,
and we hope
they're learning how to be in a relationship, and yet the
right.
relationship might be abusive, and I can say they feel, oh, that's normal, he loves me, that's why he put my
no, you're absolutely right. Yeah.
Whatever. So that's why I wanted to just ask, do you work with young people as
Yes,
well?
we do. Yes, we do. And that's I'm glad you said that because a lot of times the vast majority, the young people nowadays think it's cute.
Correct.
He called me a B. Oh, he just tripping. He just playing. No, he's not. He's showing you who he is.
Right.
And this thing escalates. We have clients where I don't want to being a great cop, but we have clients that were beautiful 16-year-olds murdered because they wanted to leave. So it's serious out there, and I hope y'all spread the word. And it doesn't have to be the one. You don't have to be the one. Spread the word. Let them know it's not cool. It's not cool he stopped you one time. It's not cool he tripped you or even she. Don't get it wrong. Women is being men too.
Right.
And it's not cool at all. So we're here. We already matter. Any more questions?
Any other questions? I don't have a question, I have a request. If you could give me the flyer to spread the
Yes,
word.
ma'am. I got you. They up there.
Okay. And we'll put them on the front window, we'll blast them, and we'll have them at meetings also.
Next general.
And I'd like to invite you to our general board to speak in public session.
Love it.
We have a broader audience, get the word out. This is very important, and I'm so glad that you're here. And we're able to touch upon this very sensitive matter.
Right, Ethan, that's 2 Thursdays, rather.
One Thursday, after this Thursday is one Thursday away, it's the 16th, January 16th.
And sign up for public session, and that goes for any of you that's on Zoom. We have a number, number of you on Zoom, but particularly the domestic violence issue. January
16th, it's down the hill at Columbia, the forum at Columbia University. Yeah, it starts at 6:30. And you'll see myself and my staff member to sign up to speak in public session.
Okay.
And we very much like for you to come.
That's okay.
Yeah.
Right, and the passion is there, that's what Heather was saying, the passion, and you really express it very well in terms of what's, down to earth, what's really, like, this is the real deal.
Correct.
This is what's happening, it's not sugar coated, but this is the deal.
Yeah, I think caring, especially from a man, is so important.
Yes.
And, you're out there and just laying it out straight. It's important to keep hitting home and to say it's not right.
And you have a public session 3 minutes. You can get a lot in, but just know that, you might want to just do an outline and get all your points out. But 3 minutes in public session.
Well, everybody who's been on, I mean, obviously there's a thread, and I hope everybody's been on will connect. Like you're connecting with, you'll connect with Wendy and then connect with Isaac and everything, because it's all interconnected. And Maggie for sure,
Yes.
Right.
So.
Thank you. Thank you so much. And don't forget, if you can send your attendance form before 9 o'clock, I'll ask you to print them out for me so I can sign and get them to scan them back to you. Okay. So we're almost done, but we have 2 important special presentations. Darren Hoke from actually he's from the Department of Health and Mental Hygiene. He's talked to us before. He's the Community Action and Response Supervisor, and we know his program as 988. But Darren, if you could take some time and we'll do Q&A to discuss your community wellness and resilience training. And when I talked to you on the phone, I mentioned how some people commented that the 988 number wasn't working efficiently, like, in other words, someone mentioned they called and they did not get any, response, or they got a response on the second call stating they would be there, the people didn't show up. So I don't know, if you could explain how it should work, what else we need to do, because we're telling people otherwise that 988 is a better call than 911 for those suffering from mental illness.
Okay.
Darren Hoke. Go
Okay. So
for it.
good evening, everyone. It is nice to be here again with you guys. Community 9 board. And Happy New Year. So the last time I was here, I think it was back in April or May. I know it was the summer was coming up and we kind of went through 988 and a few other mental health oriented subject
Yeah,
matter.
and we passed a resolution also, Darren, at the following community board meeting in support of 988 and more funding for 988, so that more community awareness or public service announcements could be made about 988, be restored to that 988. But go ahead, you have about maybe 7 minutes now.
Okay. So I hear, Laquita informed me that, some folks reached out to 988 and there were some concerns, some, I guess, expectations was not met, and maybe possible you encountered some glitches. So I just wanted to kind of reiterate what 988 is, as well as remind folks how much of a robust program that 988 is. So just a quick recap, 988 is considered a hotline and it is for the purpose of folks who are experiencing some type of distress or a mental health crisis or feeling lonely or feeling suicidal. It is a line that they can reach out to get support. And the support that they're reaching out to can be a social worker or mental health professional or a peer. And a peer is someone who has lived experience, meaning that they may possibly live with mental health conditions themselves. They may have some type of experience with the incarceration system or justice involved, or have experience with the hospitalization process in some of their systems. Because sometimes folks who are reaching out for support may not necessarily want to talk to a social worker or a mental health professional. They may not want to have a clinical conversation. They may want to talk to someone who they can identify with, and the person has shared some of the same experiences, whatever they're going through at the time. Also, 988 is a resource bank. So people can reach out to 988 if they are in pursuit of identifying a therapist, a counselor, any kind of social service program, any kind of youth program. They are a resource bank and they will provide that individual with 3 referrals that they can follow up on based on whatever it is that they're looking for. So just a friendly reminder that folks may remember NYC Well, right? And NYC Well was a hotline like 988 that focused only on New York City, right? And so at that point, it was the same services that I'm explaining now, and it was working fairly well, right? Really being available to individuals who are in need of some type of mental health support or are feeling lonely, or really need to be connected to some type of service. Because of the um, the the good that it was doing, right? Because it was really fulfilling such a large need. Um, Governor Hochul wanted it to become statewide as opposed to in New York City wide. So that's when it transitioned into 988. So along with that transition comes a more wide range of people calling, right? Calls to be filled or these incoming calls. It just created a much robust system, which was good, but also came with some complications. So, some of the common concerns and plights that some people have is that when they do call, they are on hold for a long time because it's just such a high volume of calls. Because these calls are typically coming from anywhere in New York State, as well as even in other parts of the country. And then once you do get, you reach someone, they then connect you to your local area, right? And so when you get to your local area, then they're trying to field that call according to what your need is. If you want to speak to a peer or if you wanted to speak with a mental health professional. So I share that to say that I always remind people to really manage your expectations to the best of your ability. Be really patient when you reach out to 988, because it can sometimes take a while to actually talk to someone. Um, you sometimes you are on hold because it's just such a high volume of calls. Um, can you hear
So,
me? So I know that that's just one
um,
of the complaints, but I
so
would
Derek,
love to
let's see if
hear.
there's some questions as relates to 988. Because it's certainly an important program. And the problem is that there's so many people who become frightened, of course, because they may not know what to do in a stressful situation, dealing with someone that we know could be a relative, but that they know has some mental illness, but they become a different person and more extreme, and not necessarily always so, but perhaps they are becoming violent and they don't know how to handle it. So the first thing they do is call 911, but that could precipitate an even worse situation like death.
Right.
And that has been happening, more frequently. So we're trying to push the 988, but it sounds like not only is there need for more funding to let people know it's there, but if that 1988 is going national and there aren't that many people and the people you do have are on long calls, how can that be managed to at least make some increase in how much you can do and accommodate?
Hmm. So it's not national, right? It's statewide. And then as the call comes in statewide, it is then field to here to New York City if the person is calling from New York City. But what happens is sometimes if I am in Washington, D.C., and I am stressed and I Google, a hot helpline, 988 may pop up and that person will call from Washington. And then once they get through, they are then either redirected to call their local hotline or depending on the situation, whatever that person is saying, right? If it's a heightened crisis, then they will keep that person on the line and make the connection themselves. Right. So I just want to be clear, it's not a national line. It is still a statewide line. However, those calls are fielded to the localities based on wherever you're calling from. So while you're making that, while you're reaching out and you're initiating a call, it sometimes, not all the times, it sometimes may take maybe 2 to 3 minutes, which feels like a long time when you are in a state of anxiety, or you're dealing with someone who is increasingly becoming angry. Their personality is changing drastically in front of you, and you want to make that connection, right away. I just want to encourage people to do your best to be as patient as you possibly can. But I also want to encourage people to, if you know that it is mental health related, call 988. However, if that person is that violent where you feel like your life is in danger, then you really do need to call 911 and hope for the best. But if there's a situation that you still feel somewhat safe, that you still feel somewhat, in control, then I would encourage you to call 988, because those are mental health professionals that will be respond to whatever the need is, and hopefully the issue will be resolved. But also know that 988 is, there's other calls, right? Because you may be dealing with a relative that's increasingly becoming symptomatic, not dangerous, but symptomatic. What do you do? This person's symptoms are becoming worse and worse and worse, right before your eyes. So you call 988 and they kind of process everything with you and see that maybe a mobile crisis team needs to be called, or maybe you need to get to a therapist, or maybe you need to go to a CPAP. So whatever the situation may be, but I strongly want to encourage folks to still make sure that 988 is your first option when it is mental health associated.
It's so interesting because now, even though crime is down, there is so much that's being attributed to mental health. Even this morning, as one of the council persons or state legislators talking about congestion pricing, they were, of course, speaking against it and saying you can't have congestion pricing because not only the cost, but that puts more people on the subways. The city's not managing the subways for all the murders, and they're just hyping the whole mental health reason for what's happening on subways. And I'm not sure what the motive of these is, but they're hyping it, and everything gets put to mental health. And of course, we see what we see and know what we do know, and it does seem as if yes, crime is down, but there's still crime, and what we're seeing is a lot of uncontrolled behavior on subway. And it may be that that's not up any higher, it's just that it's more known and we want it to be known, but it's a big issue. So in every facet, every aspect, we need to find some way of tackling it. So the whole mental health and mental stress, mental illness, a lot of it we will not see. It's just something's going to happen, but we got to find some way to tackle. Quick question, Darren. Since there was a decision made to go statewide because the need was there, I assume your team is collecting demographic information to help track the need, which it seems to be increasing. And I guess the question I'm asking is, it sounds like there aren't enough team members or staff to take the calls, but you guys are collecting the data. Is there any way that can be, I'm sure, shared with the governor if it's not being done already, to increase support for this program? Because we know the need is tremendous.
Yep. So that's a great question. So just for clarity, my office does not directly oversee 988 for the New York City region. it's my colleagues, but I used to work in that office. So I do have the answer to your question. So the answer is yes, that there is uh, an abundance of data that is collected, as it relates to 988. Some of the data do cover demographics. Some of it covers call frequency. Some of it, I mean, it's a huge range of data. And because there is such um, heightenedness around mental health because of, as Laquita was saying, with the media, what's happening sometimes on our subway systems, what's happening in the street, and just the fact that, the mental health crisis is at a peak that we have just never seen it before. And so it is going to require um many different programs, approaches, understanding. I mean, it is really going to have to be all hands on deck, which is why the last time I spoke, we also talked about the mental health first aid training, which really trains the community on how to act and how to respond to mental health crisis, whether it's in their family, whether it's on the train, whether it's your cousin or a loved one, anywhere in the community. So it's going to require for everyone to be involved, but we do the data is reviewed on a regular basis. I believe it's every month, once a month. It's heavily scrutinized, and they are, constantly hiring and training. The hiring and training process is very thorough for 988. As you could imagine, like you have to have a wide range of skills and understanding, taking those kind of calls. So the hiring process and the onboarding is, I believe it's like 45 days of really intense training, but that is always ongoing. So they are aware of, where they could use, additional mental health professionals, um, as well as the time of the day or the time of the night or the time of the wee hour when more counselors need to come on. So they understand when there's ticks that go up and when there's also declining calls. So just an answer to your question that yes, the data is reviewed on a regular basis, and it is troubleshooted, as needed.
Laquita.
Thank you, Eric. I'd like to use this time to say the information provided is so important. We have to put a lot of thinking to how we can assist DOHMH with this particular program that we see as being so important. And I'd like to see if you would come back next month on the community wellness and resilience training.
Yes.
Do that for us at the February meeting. So
Sure. Yep. I would definitely like to do that.
Cards,
Mm-hmm.
which would extend us longer than we should. So can you do that February 2nd?
Yes, February 2nd, I can come back and I'll be with a colleague, and they can talk about the community wellness and resilience program, which is a similar program to the mental health first aid training, but it's slightly different. And then I also would like to come back maybe March or April, to provide you information on some children's mental health programs from the city standpoint, right? And one of them is called CSPOA, which is the Children's Single Point of Access. And that is how children get referred to a variety of programs in whatever it is that they need. So if that is of interest to you, then we could go with that.
Absolutely. So it wouldn't hurt, even have the children's, program in February, if you put that together, February
Can't do it for February because they require, they, re-
second. In March, but if it's easier the other way around, but if you could put all the pieces together as soon as possible, that would be great. Then we'll, reserve time February and March.
sure.
Okay, so let's talk during this week.
Okay, sounds good.
Okay. Thanks, Darren. I'd like, and this is our last special presentation, and it's very special because it concerns a projection for the future that we don't know how it will end up or what will ultimately happen. But our former general board chair, as well as committee chair, Pat Moore John, was in conversation with Monique and I at our last general board meeting. He said, I heard someone really speak on this Project 2025 that we need to really spend some time with on just that health and environment portion or the health portion. And he recommended to us, and I don't, Jamie beside us today, he raised his hand there. And so we are excited to hear, Jamie, what your comments are, especially it's extremely relevant because I'm assuming that a lot of decisions have been made and are in place, but that doesn't mean that it's written in stone because when we have information, we can do better. We can do well if we act on it, if it's something that does not represent our interest. So, it's, correct me if I said your name incorrectly, but welcome to the Health and Environment Committee, MCB9, and we thank Pat Moore for recommending you, and we really are grateful for your accepting this invitation. So, I'm sure there'll be questions and answers afterwards, but if you could give us your key takeaways as it relates to health and our committee, Health and Environment. Thank you, Jay.
Can you hear me?
Yes.
Okay, thank you so much. I'm trying to share the document. Will you give me access to share the document?
I did. I was your host.
Can you see it?
No.
So
But
I
you're
don't know.
listed as a co-host.
I'm sorry?
You are listed as a co-host. I made you a co-host some time ago.
So I don't, can you see it now?
No.
Okay, so look, I have to be very honest. I think that you deserve that from me.
Hold on, let me just.
Erica.
Oh, you got it?
Can you fix this? The PowerPoint? The presentation is on Project 2025. My wife is trying to get the PowerPoint on, so I don't know.
Yes, I have her as a co-host also.
So can you?
I don't know.
It's not showing up.
Oh, you mean?
Okay, forget it.
There's nowhere to.
Okay, look, I can.
Can you share it, emailing it?
I emailed it to you guys already. Check your email.
So that means it's at my email.
Yeah. So.
Oh, give us 1 second. Isaac, Maggie. Under what name did you email it?
Jaime Estades, JAIMEESTADES. Look, can I say something just to make sure that we don't waste too much time on this?
Sure.
Okay, so look, is everybody paying attention?
Yes.
Okay, so look, we're talking like family now, okay? This is the deal. Project 2025 is an 880 pages document that it was put together by the Heritage Foundation. The Heritage Foundation is one of those institutions that do studies on social and public policy. However, the Heritage Foundation, for more than 90 years, they have been producing documents on policy that are right-wing conservative policies. They never had, since the 19th century, and who knows, maybe even before the Civil War, a government that was willing to implement. Can you hear me? I have some feedback.
Yeah, we're working on the document. Go ahead.
And now they have a government that is willing to implement all those policies. Let me go straight to the point. Every program that has been mentioned here tonight, every program for each one of those areas of need in the community, all those programs are going to lose fund. So if you think that we have it bad right now, and based on the comments and the experience of the brothers and sisters that have presented already before me, is nothing. I don't want to be dramatic.
Can you tell us which slide to go to? And if you direct us, Justin, our committee member, will help.
We can go to number 2. So every program that we have discussed here today is not in danger. It is going to disappear. Danger is something that we can prevent if we see it, the potentiality of the danger. We're talking about losing programs, social welfare programs. This is so conservative that it goes back to the 18th century. That's the mentality of the Heritage Foundation. And like I said before, this is an 880 pages document. They touch every aspect of society that they want to eliminate, and services that we now receive, and they are going to cut the funding right after January 20. Immediately. And I know it's January 20 because the press is going to be inaugurating January 20, and January 20 is my birthday. So that's my gift.
Happy birthday, Jamie.
No, it's not going to be happy. And it's not going to be happy for any of us. So we need to understand that behind these policies, there is a whole political philosophy of thinking that is conservative. Trump ran on those policies. Maya Angelou told us that when they tell you who they are, believe them. I believe them. What they're saying that they're going to do, starting in January 20, they are going to do it, and I believe them. They have something called the unitary executive that started in the 17th century when the 13 colonies existed and before the Constitution of the United States was created. The unitary executive was a concept in which it gave all the powers to one person. During those times, it was the king in England. And even during the discussion of the Constitution of the United States, they said that the president should have more powers than anyone else. But what is being presented until this concept that is in Project 2025 is to give even more powers to the President of the United States and less powers to Congress, less powers to the Senate of the United States. So those mechanisms that we had, that we still have until today, in order to put checks on the presidency, are going to disappear. Okay, now, can we get to the second slide? Okay, please. Let's go to the other one. Okay, Supreme Court of the United States has been acting already, as you know, basically on all these decisions that we have received in terms of abortion, rights to abortion, issues of immigrants, how we're going to protect people of color. All those things have been debilitated already by the Supreme Court of the United States. I'm a lawyer, I'm a social worker, and I teach social policy at Columbia. This is something that I have been teaching for a long, long, long time. And I can tell you that all those guarantees of liberty that we had are going to be diminished dramatically. And with that, the funding that you all get in your agencies is going to disappear because they are telling us that they are going to cut them. Now, you can say, well, the state government is going to help us. No, the state government depends on those funds in order to provide funds to us. So when they cut it, they're cutting the funding for the state governments, and the state governments are going to be cutting funds on us. They're going to be... Hello?
Ask me a question. In light of recent developments, say the close count in the House of Representatives where it's something like 215 to 217 to 18. What kind of hindrance would they have in totally enacting this? I mean, I can't see us just rolling over, the Congress rolling over and falling on this. Also based on, we didn't know at the time that, say Elon Musk was going to be playing a role. Now there may not be a lot of favoritism, but there's toward him, but there are some disagreements even among themselves in terms of certain.
Yeah, the disagreement among themselves, the disagreement
About that might alter some of the extremes.
Like I said before, the mechanisms that we have as of today to make sure that we have deliberations and come up with a consensus in the House and in the Senate of the United States, those mechanisms are going to disappear by law. The Senate itself, the House of Representatives itself, that they control, they're going to be voting against their own interest, because their interest is, according to the unitary executive theory, is to provide more powers to the presidency and less powers to the other branches of government. We are in the route to a dictatorship. This is not me being alarmist. Okay? Now, there are going to be cuts to welfare. There are going to be cuts to health care. There are going to be cuts in terms of workers' rights, in which the corporations and business will have more power. Elimination, and they have stated already, the elimination of welfare. All those things are in the shopping block. I know that is difficult to believe, but they wrote it.
I'm just wondering, we have the information. What can we do? We know the information.
What can we do?
Yes.
There is not much that we do, to be honest with you, because the chance that we had, we lost it during the election. Now, we are organizers. Everybody here is an organizer. We can organize, but this is not going to be fixed until the next election. We need to organize for the next 4 years. The damage is done.
2 years?
Hello, I can barely hear you.
Oh, 2 years? We have a technical issue here.
Yes, look, can we do this another day? Because I think that this is important.
It is important. We just haven't, we're hearing you as long as, okay, now, is that better? 2 years possibly, I'm hearing also, with the next election will be in 2 years.
What election? 2 years. The next election is 4 years.
To a midterm.
The midterm election in 2 years, it will depend on how we organize the vote, but it's not going to increase that much because the other states besides New York, here in New York, we know what we have and what we can win. But this election for president, remember, it was not only electoral college, it was the majority of the vote in the United States. The majority of the people voted for where we're going. So now we have to convince those that voted the way they voted to convince to vote differently. At this point, they feel very empowered. At this point, what they're going to be doing in Congress in the next 2 years is debilitating the right to vote in the United States. They have stated that. I know it's difficult to believe that, but that's where we are at. So the fight, we have to give it to, but the fight is going to be really hard. So that's the reality. The numbers don't lie. He won overwhelmingly with the vote of the people. Majority, not only electoral colleges. New York is always going to be Democrat. We can do whatever we want here, but we're not going to get the funding because most of the funding comes from the federal government. One of the things in Project 2025 is the elimination of public housing in the United States. The largest concentration of public housing in the United States is in East Harlem, and South Bronx. The largest concentration of public housing in the United States. So now what they want, and they stated, it's in the document, I'm sorry that this thing is not working, but so I'm talking from... So can you move this thing? Housing, Project 2025, ask for the dismantling of public housing. Did you get that?
Yes.
Dismantling of public housing and privatizing public housing with no remedies or alternatives to aid tenants, children on welfare, elderly and disabled in finding jobs. You know who wrote this? Because this is copy and paste. I'm not that smart. They wrote it. This is copy and paste. This is what they say that they are going to do. Everything in these slides and the other slides is copy and paste. Public housing, they're going to cut the funding to public housing, making sure that there will be no repairs, because most of the money for public housing comes from the government, state government, but also from the federal government. If they stop providing those fundings, there is so much that the state government can do. You know what is going to happen? Repairs won't take place. And you know that even now, repairs don't take place. And that is going to force them and give them an opportunity for the tenants. They have only one option: increase the rent of the tenants in order to pay for the repairs. Are they going to increase the rent? They have no other option. If they do that, people won't be able, a lot of people won't be able to pay the increase. And if they cannot pay the increase, the alternative is dispossess. They're going to throw them out. This is part of the whole strategy. I'm not making this up at all. This is copy and paste. They will also reduce legal aids budgets. This is copy and paste. It will also reduce legal aid budgets to absorb many tenants seeking legal relief. So there's going to be a lot of tenants from public housing that won't get even legal aid. So what is going to happen is that the tenants will have to be asked to leave the apartment. And what they have stated is that now once they're dispossessed, once they're asked to leave, they are going to rent the apartments. Guys, are you listening? Because I don't know what is going on.
Jamie,
Yes.
we have to wrap up. Can you join us with there'll be more time and more perspective in February?
Look, I need an hour.
Oh my goodness. Yeah.
No, look,
Maybe,
wait. Can you
let's
please
talk in between and let's continue in February, because it's still, that's when everything we'll know even more. Okay.
Okay.
Only because we have to wrap up here and they need to close down.
Thank you so much.
Okay. Thank you so very much. But can we talk? I'll get your information. I'll email you, and then we'll continue February. No, I thought he was right. Somebody. Okay. Thanks, Jamie. Okay, everybody, we have to wrap up here at the district office. And Michael, thank you for taking minutes. And we'll see can I get a motion to adjourn? Second. 8:56. 8:56, okay. Have this going to you. Here, let me just, yes, let's. Well, actually, here, let me turn it down.
Laquita, I'll try to send you the notes sometime either tonight or tomorrow.
You can just over the next couple of days would be good. Let's get out.
Okay.
You send it to me.
Okay, sounds good.
Send it to me. I don't want to get part of an email with more people in it where it might get confused and something else picked up. Yeah. We'll probably edit and all of that. Okay.
Sounds good.
Thank you, Michael.
All right. Have a good night.
Thank you.
Happy holiday.
Have you adjourned?
Yeah.
Okay. 8:56.
Thank you so much.
Thank you. Good night.